So good morning, guys. We're doing some really cool lectures, in my opinion, for the next 3 or 4. I can't remember how many. And the reason why these are useful lectures is that this is going to apply to what you're doing in private practice. And this is very practical. Most of the things that I'm talking about are things that I directly use in practice, or you could use in practice anyways. I'm going to first of all go through and explain various herbal actions and how they can be selected for certain conditions. And then we're also going to give you some examples of those herbs in the first lecture. And then the second lecture, we'll go into more detail on those herbs. So you kind of learn about the actions first, and we kind of mention a few herbs, and you won't remember them there. And then we'll talk about the specific herbs afterwards, and hopefully reinforce what those herbs are. And then the third thing that we'll do is we'll go through and we'll discuss specific conditions and explain how we would go about treating it in practice, or how I would go about treating it in practice. And that's very useful stuff. It's not just herbal medicine. I'm going to be talking about other things I might use in conjunction with it and how I might work up some cases and stuff. But when you're in 4th year and you're in clinic, dig up these lectures. I think you would find them useful. I think in general these are useful lectures. And what I'll be doing is also bringing in real cases that I've had in my practice and showing you what happens, how people get better, and if people don't get better or they get worse, I can give you a couple of anecdotal stories on that as well. Okay, so I think this is good stuff. And this is going to be a little bit easier. It's not quite as abstract as the stuff that we talked about with phytochemistry. Now, one of the things that we're doing is some of the phytochemical stuff that we discussed in the first half of the term will be coming up again. Like if we're talking about a specific herb and it's an antimicrobial, then I'll say, remember we talked about isoquinoline alkaloids? That's the main active ingredient in this herb, okay? So although you don't necessarily have to go back and read the lecture slides from the beginning of the course, that material does come up again. And the reason why, I'm all about repetition. So for really smart people who have a photographic memory, maybe repetition's bad, but for the rest of us, I'm hoping that a lot of the stuff we're talking about in the second half of the term, a lot of it's you've heard it in the first half to some degree, okay? And then we build on that, and then there's lots of new stuff as well, okay? So when it comes to herbal actions, we're going to be focusing on the gastrointestinal tract, and that's an area that I see a lot of patients in clinic for various conditions like heartburn, irritable bowel syndrome, constipation, diarrhea, excessive burping, excessive gas. I would say that the GI tract is an area that naturopaths have the potential to have really good outcomes. And when you go into private practice, I would say you would want to make certain that you feel comfortable treating these conditions. Because even if you went in and decided you want to go into fertility, I would say there's a lot more people out there with heartburn and IBS and constipation than who have fertility issues, just as a numbers game. And so when you're creating your practice, you want to maybe focus on something that you're really good at. But, even if you go into sports medicine or women's health, these conditions come up in every single, lots of people have these things, like heartburn medications are one of the biggest medications on the market. And what I will say is with gastroenterologists, I think they're really intelligent people, and I think that they're good at assessing and diagnosing various conditions. But unfortunately, their entire system of medicine is based on prescription drugs or drugs in general, and also on surgery. And so a lot of the conditions that we see, we don't need those powerful drugs to treat. A lot of them, you just need to change the diet. Sometimes you change the diet and you might recommend, it could be like a few simple herbal teas, or tinctures can really have a positive effect, or some kind of encapsulated herbal product. And so herbal medicine is well suited for treating gastrointestinal conditions. And with children, a lot of these herbs are safe and you can use them with them as well, okay? So when it comes to the gastrointestinal tract, what we're going to do is review the most important actions used with the GI tract. And appreciate when we're talking about herbal actions, these are things like anti-inflammatory, diuretic. That's what an action is. It describes sort of what it does. And when it comes to herbal medicine, the actions we're talking about in the GI tract aren't necessarily only used for the gastrointestinal tract, okay? So if you're using an anti-inflammatory herb like turmeric, yeah, we could use it for conditions like colitis, some kind of inflammatory bowel disease. But you could also use it for other conditions that are outside the GI tract. So like a herb like turmeric could be used for things like colitis and digestive upset, but it can also be used for, it has an antidepressant effect, and that's through its anti-inflammatory effects. It can be used for arthritis. It may be useful in treating various cancers through its anti-inflammatory and anti-cancer effects. It could be useful for slowing down other degenerative diseases. So we'll learn about actions here, but they're not exclusive to just the GI tract. Now, later on we're talking about herbs, I've already mentioned this before, but a herb like turmeric, for example, yes, it has an anti-inflammatory effect, but it can also have multiple actions associated with it. Again, anti-cancer, antidepressant, carminative. Those are just a few that just pop to mind right away. So there are multiple phytochemicals inside the herb, and that's why one herb could have a dozen medicinal actions associated with it. Now, sometimes one active ingredient could be responsible for 3 or 4 actions as well. So, for example, curcumin, one of the main active ingredients in turmeric, it has the anti-inflammatory effect, but presumably it's also the compound, well, actually I know for a fact it's one of the compounds that also has the antidepressant effect. And so there could be multiple actions associated with that one phytochemical. But you can also have the anti-inflammatory effect of turmeric is also associated not just with the curcumin, which is the polyphenol, but there are also polysaccharides or sugars, carbohydrates, that are immunomodulating, immunostimulating that appear to have anti-inflammatory effects as well. Okay, so this is one of the cool things with herbs is that they're very complex. There's a lot of stuff going on in it. So those phytochemicals and those phytochemical classes that we talked about in the beginning of the course, they are responsible for these actions. And so that's why they're going to come up again. Again, do you have to know the phytochemicals? No, they're herbalists 10,000 years, actually 200 years ago, 100 years ago. Even today, there's herbalists that know very little about the phytochemicals that can successfully treat people's conditions. And sometimes I think people can fall into the trap that you can get into that reductionistic model where you think that, oh, the active ingredient in turmeric happens to be curcumin, therefore I should just give the patient curcumin only. And I think that when you isolate a single phytochemical and give that in isolation in high amounts, it takes on a different property. It becomes more drug-like in its action. It may be safer than an anti-inflammatory prescription drug or a non-prescription drug like aspirin or ibuprofen, but it is different. It's not always safer. It's just different than the whole herb. So appreciate when we're talking about the actions associated with a herb may not, if there's 10 actions associated with one specific herb, it may not apply to the active ingredient. So curcumin is a polyphenol, and it might have anti-inflammatory, antidepressant effects, but the carminative action may be associated with other phytochemicals in there, like the essential oils. So just appreciate, don't just assume if a herb has mega doses of high amounts of one particular phytochemical in it, doesn't mean that it's superior to the whole herb. Things like herbal teas like chamomile tea, they're effective quote unquote drugs or therapies. Even though it seems chamomile is not very prestigious to a lot of people, just the fact that you can buy it at any tea store or Starbucks or any of the various cafes will all have chamomile tea. You can buy it inexpensively at every single grocery store, but it has a lot of significant medical properties associated with it. And drinking it acutely for digestive upset or taking it long term for as a source of phytochemicals that can prevent heart disease and cancer and stuff like that, it's a pretty neat plant. Okay. So when it comes to conditions, one of the things that you might do is somebody comes in with a particular condition. You might think let's say you don't have a diagnosis for that person. They come in, they complain of stomach aches, they're getting cramping pains, they get a lot of burning going on, they get some urgent diarrhea. You may not know what their actual diagnosis is. You may not know if they have Crohn's disease or colitis or an infectious diarrhea or whatever it may be. But based on their presentation, you can select specific herbal actions that can help make the person feel better. In some cases, it could cure the person. In other cases, it may just only help relieve symptoms. And so there is a place for both. Obviously, we always want to try to cure the person of their disease, but there's some cases where it's impossible to cure them, and you have to just manage symptoms and make them feel better. And sometimes you got to make them feel better and manage the symptoms while you're trying to figure out what the cause is and how to treat the underlying cause of it and try to quote unquote cure the person. Okay. As we mentioned earlier, some of the herbal actions we're going to talk about will overlap with drug actions. Anti-inflammatory would be an example, or antacid. But then there's a lot of herbal actions we'll talk about, like carminatives, bitters. These things don't really exist in the drug world. So there's overlap, but there's some unique actions associated with herbs that you don't see in the drug world. One of the things that you'll notice is that some books will use, like, there isn't a standardized group of actions that everybody follows. Okay, and that's just the challenge with language in general. So nobody sat down and said, yes, we as herbalists should use this name of the action and not this one, because there's a lot of synonyms with these actions. So for example, an herbal action that combats ulcers of some sort could be called an anti-ulcer herb, or it could be an ulcer protective herb. Sometimes it might be called gastroprotective, which would be the same as ulcer protective. So I'll describe a number of them, and you might, reading one particular book, they may use a different term than I've taught you, and you're just going to have to figure out, oh, that's just the same. So if someone uses gastroprotective and they don't say anti-ulcer, you can probably deduce that it's the same sort of thing, okay? And then also sometimes what you'll find with herbal actions is there are some redundant terms. So a herb might have, let's say, a turmeric, for example. They may have a list of actions associated with turmeric that includes anti-inflammatory, anti-arthritic, anti-rheumatic. But by deduction, if you know it's an anti-inflammatory, it's probably going to be useful for arthritis and for rheumatic diseases. Rheumatic diseases are kind of an umbrella term that includes arthritis in it. But you will see some books will specify more, and maybe how, depending on what section of the book they're describing it, they'll go into more detail, okay? So don't be thrown off if you see some actions that you're not familiar with when you're reading books in the future, okay? And as I mentioned earlier, some actions will affect not just the gastrointestinal tract, but could be like turmeric, cardiovascular system, liver, gallbladder, nervous system. I'm sure it would have benefits in the respiratory system, although I can't think of any cases right now. But so we're going to teach you some stuff that will come up in some of the herbs, and some of the actions we're going to discuss will appear later on in your herbal medicine career, okay? This is a list of things that we're going to go through. I think that's most of them. I may have missed one or two, but I think that's going to be the bulk of the ones that we're going to talk about, okay? I don't know. This is just how my brain sort of organizes things. We may want to revisit this later on. But there are some of these things that are often related. Some of them are directly related, and we'll talk about bitters. Will be the first one we talk about. And sometimes I would say that by deduction, if you know a herb is a bitter, then we know it's going to have these actions. And sometimes there are some ones that interact with each other and some that oppose each other. And we'll just go through this. This is kind of might be useful afterwards to look at. Okay, but here's a list of actions and kind of how they're all indirectly or directly related. So we're going to start with bitters. So here's a bunch of bitter herbal extracts that you can buy at the LCBO. And appreciate that digestive bitters have been used for an awful long time. I don't even know how long, thousands of years. Probably since the beginning of time, human beings and even humanoids have been using bitters, whether they know it or not, to promote digestion. And I would say that as a species, we used to run around outdoors gathering leafy vegetables and even the fruits that we used to eat were more bitter. And I appreciate, like, when you're eating leafy greens out of your front yard, if you're eating dandelion or chicory or other things like that, they will have a bitter quality associated with it. And these bitter things we've been eating for a long time. And probably what's happened over time is that as we evolved eating these bitter things, we also probably evolved recognizing that the bitter taste is associated with eating food. And so when you eat something bitter, it has a general stimulating effect on the entire digestive tract. And so a bitter tonic is a unique kind of term for herbal medicine. Now, a tonic, anytime you see a tonic, it means a substance that tones. So a bitter tonic is used to tone the digestive tract. And what toning means is, I think about your muscle tone. If your muscles are kind of flabby, then you want to tone them to make them, have better strength and tone to them. But it's also bad. You don't want to overstimulate or overtone your muscles because then they can become cramping and have pain associated with it. So with most things, when you tonify things, you get those organs or those muscles to work better. Okay, so a bitter tonic or a digestive tonic is something that basically tonifies or stimulates the entire digestive tract. And where you would want to have this action, or where you'd select this action, is for a number of conditions where there's poor digestion going on or insufficient digestion. So a lot of the time, indigestion or dyspepsia it's not a real disease per se. It's a cluster of symptoms where somebody might feel heaviness and bloating and may start getting some reflux and heartburn associated with it. And so it may be that's a result of the person has overeaten and there's not enough digestive juices to sort of support the digestive function for what they've consumed, or they ate more of a particular thing. So that's where a digestive bitter, you take a little bit of a bitter after you've had a large meal, it can get your digestion flowing, the juices flowing. So atonic digestion might be that in general, so indigestion is usually from excess, eating too much of something or just too much in general. Well, atonic digestion can cause indigestion, but usually that's just because the person's digestive tract is just sluggish, lazy. It's just not working as well. And so that's where it needs to be tonified. And that can happen if people are convalescing, they're feeling sick, or if maybe they eat a diet that's void of bitter substances. So a lot of people, if they're eating more of a Western type of diet where a lot of fast food, sweet, carb, dense, greasy foods, it doesn't have that bitter that that you want. Because like a hamburger, yes, it has lettuce, but iceberg lettuce, it has a little bit of bitters in it. I mean, the sesquiterpene lactones in the lettuce, it's very, very minimal. Well, if you get something like dandelion greens or chicory greens, they're going to be much more abundant and be more stimulating. So you could recommend bitter tonics in the form of just eating salad. That would work. Or you could do a herbal extract and take it that way as well. Some people will have poor appetite, and poor appetite may be associated with the atonic digestion. They're just not very hungry because for whatever reason. And so you give them digestive bitters to stimulate the digestive tract. And appreciate bitters historically were used in the form of alcohol extracts, like I showed you on the first slide, as an aperitif, something that you take before a meal to stimulate digestion, or a digestif, which is something that you might take after a meal. So sometimes if I'm at a restaurant, we have a big meal, and not that I've been to a restaurant in a while. Once you have kids, you don't go out very much. But anyways, you have a nice meal. You maybe ate a little bit more than you normally would. I might get let's say a Campari on the rocks, or a Campari with grapefruit juice. And that has this bitter quality that will help to promote digestion. Or if you want to have an aperitif, you might have a gin and tonic before a meal to stimulate your digestion. Or a martini. These are all things that were historically used in culture, not just by herbalists, but in our culture in general, to help promote digestion. There's some other conditions that bitters also play a role in, and that's gallstones, and we'll talk about that later on. With gallstones, if you're not making enough bile and releasing enough bile, the bile becomes saturated with cholesterol, and that cholesterol turns into little rocks, and those little rocks get bigger and form larger stones. And so gallstones, they can be caused by a few different things, and we'll talk about them more, at least twice that I can think of. But gallstones are usually due to an underactive digestive tract, okay? Another thing is sluggish bowels. Some people with chronic constipation can improve by taking more bitters in their diet. And the reason for that is that the bitters increase the production, help break down the food better, so things are able to move along better, but also by stimulating the release of bile. Bile, when it hits your intestinal tract, it tends to irritate it and cause peristalsis and promote the movement of your intestinal tract. And so, although digestive bitters aren't necessarily classified as primarily as a laxative, indirectly they can have that laxative-like effect, okay? So, one thing, when it comes to digestive bitters, not everything that tastes bitter acts as a digestive bitter, okay? To give you an example, if you were to take codeine, or any of the opioids, or any of the or even the anticholinergic drugs like atropine, if you were to take that alkaloid that are in either one of those two and put it on your tongue, it would taste very bitter, because alkaloids in general have a bitter taste to them. But the thing is the reason why those herbs don't actually act as digestive bitters is because their effects on the nervous system overrides their effect that just the bitter taste would normally exert on the digestive tract. I think I'm getting ahead of myself, because I think I mentioned this on the next. Maybe I don't, but it'll come up later on, okay? So not all bitter tasting things will have that herbal bitter action, that bitter tonic that we're describing. Some of the herbs that we talked about already, and phytochemicals that we discussed, were certain types of alkaloids, like the isoquinoline alkaloids that you find in golden seal and barberry and Oregon grape, or the quinoline alkaloids that you find in quinine or tonic water or cinchona bark, the anti-malaria, or the purines. For example, coffee has bitter compounds in it, and the caffeine has a bitter action. All those are examples of digestive bitters. So getting to Laura's question, coffee, which is a digestive bitter, is actually protective, or helps protect people from getting gallstones. And it doesn't mean that every woman or every man that comes in with gallstones doesn't drink coffee, but there's a lot of the patients that I see, and I see tons of people with gallstones, often don't consume coffee, or they have a bit of a sweet tooth. Now, other things can cause gallstones as well. We'll discuss that later. but I've been able to successfully dissolve gallstones using digestive bitter herbs, and we'll talk about that in a second. Or actually, we'll talk about more detail maybe next week or the week after. Okay. And I've got case reports, ultrasounds before and after that show that. Okay. And that's why I think these lectures are kind of cool, because this is real life stuff. This isn't just theoretical stuff. And because I have a bit of a science background and a little bit nerdy that way, I document everything I do and try to use it in the lectures. And some of it I publish, but not all of it. It takes time. Other herbal phytochemicals that are important are, for example, the lactones. Remember when we talked about lactones in general? That lactone structure seems to have a strong bitter quality associated with it. So the monoterpene lactones, like the iridoids and the secoiridoids, those compounds are responsible for the bitter taste associated with a herb that I really like called gentian, and also its cousin called centauri, or greater centauri. Those are really potent bitters where literally one drop of it is sufficient to get the digestive juices flowing. But you also find these secoiridoids will be found in things like little bits in olive oil. So the bitter, acrid taste associated with olive oil is going to be a monoterpene lactoid. And the leaves of the olive tree have been used in herbal medicine for various things as well. Now, the sesquiterpene lactones are probably some of the most important digestive bitters out there. And these are the compounds that you'll find, for example, lactucin, that is found in various types of lettuces and other cousins of lettuce. That's a really important digestive bitter in our diets. Also, things like wormwood is a strong digestive bitter. It contains sesquiterpene lactones. Chicory, endive, artichoke, they all contain digestive bitters in the form of sesquiterpene lactones. And then there are some herbs that contain diterpene lactones. There's one of them that I use for colds and flus, mostly in capsule form, called Andrographis. One of its common names is King of the Bitters, and it grows in the South Pacific. And so I'm using it as not as a digestive bitter, but for treating colds and flus. But it also has that indication in those cultures where it's used to promote digestion. And we have similar herbs here that are kind of, for example, there's a herb called horehound and marubium. These are both herbs associated with the respiratory tract that we don't give a lot of attention to the digestive tract. But horehound, for example, is a very, very strong digestive bitter. It's used more as an expectorant, something to help you cough up phlegm, used for respiratory coughs, pneumonias, bronchitis. It also probably, it structurally is a little bit like that Andrographis I talked about, but that bitter quality is associated with the diterpene lactones. Now, I know somebody out there is saying, do we need to know all this stuff that he's talking about that's not on the slide? The answer is no. You don't need to know anything that's not on the slides, okay? So when I'm talking about stuff, I'm trying to give you a context for this stuff. And some of it might stick. If it all sticks, great, you know, but I'm just trying to emphasize what's on these slides. Now, if you have a photographic memory and you just memorize a slide and you don't remember anything else, then yeah, you probably do really well on the exam. But because I have some experiences, I like, you know, linking it to other things, even if you don't need to know it for the exam, okay? So how do these digestive bitters work? I've tried to figure it out because there's not a lot of research into digestive bitters. There's some, but not tons. And a lot of the herbs that I use, for example, gentian is probably one of my favorite herbs we're going to talk about later. It's been used in European herbal medicine for thousands of years. It grows in the Alps. It's a great herb. It's found in a lot of the bitter liqueurs of the LCBO. Yet there's not a lot of research on it. So every single bar you go into, almost every single bar probably has gentian behind the counter. And it's widely used, but yet the research isn't really there for it, just because someone hasn't spent the money. But from what I've kind of deduced by looking at other research studies, it appears that the bitter receptors on your tongue, and you also have them in your stomach. So even if you don't taste it, it still can exert a bitter tonic effect, although I do think that it works better if you taste it. Sometimes tasting a foul tasting medicine makes it work better, in my opinion. It could just be because you're activating the placebo effect, because you're basically, person's going, oh my God, this tastes awful, therefore it must be helping. That could be part of it. But also we know when you stimulate the bitter receptors on your tongue, it tells the digestive tract to release gastrin and cholecystokinin. And these are kind of opposing hormones. And so I don't know exactly how they work in conjunction because one kind of suppresses the other one. But what gastrin is responsible for is increasing the production of stomach acid. And it also closes the lower esophageal sphincter to make sure that stomach contents doesn't bubble up into the esophagus. And so when people get heartburn as a result of reflux, where stomach contents kind of bubbles and spills into the esophagus, bitters can help with that. Okay. Now, what cholecystokinin does is it increases bile production and release from the gallbladder, and that can help with fat absorption. I'm assuming you guys know the way the stomach works is that that acid, and there's some enzymes in there, basically help to unravel proteins to make them easier for the enzymes to go and bite them into smaller pieces. And then more enzymes in your small intestine will be released from the pancreas to basically help break it down further. As well, there's enzymes that help to break down carbohydrates and fats to some degree as well. And then bile is soap that's used to dissolve fats, and that's made in the liver and stored in the gallbladder. Okay, so one of the other things that bitters do is when you put them on your tongue, immediately you start salivating. And that's another part of the whole digestive tract. So your digestive juices include your saliva, your stomach acid, and also the digestive enzymes in the stomach, your pancreatic enzymes that break down fats, carbohydrates, and proteins, and then your bile that specifically digests fats, okay? So a bitter tonic targets all aspects of the digestive tract to the best of my knowledge. Now, there are other herbal actions associated with bitter tonics. For example, a thylagogue is a substance that increases saliva. Now, when you take a digestive bitter, as I mentioned, you start salivating right away, and then your stomach starts to grumble. So a thylagogue, so I would say all bitters are thylagogues, but not all thylagogues are necessarily bitters. So if you were to take a parasympathomimetic, maybe you've suppressed those memories pre-midterm, but a parasympathomimetic stimulates the parasympathetic nervous system. And so I think a lot of the bitter herbs have a little bit of this sort of properties associated with it, but you're never going to overdose. Like if you take too much of a parasympathomimetic, you'll basically die because you'll start vomiting and get diarrhea, and stimulates urine flow and tearing and all these things. But there are certain parasympathomimetics that act as thylagogues, or actually they all act as thylagogues, but they won't necessarily act as a digestive bitter. They may not be classified as a digestive bitter because their mechanism of action is through more targeting the nervous system directly rather than indirectly through the taste buds. Okay, so other thylagogues we'll talk about in a second. A stomachic is a herb that specifically targets the stomach and makes it work better. And so all bitters are stomachics as well, but not all stomachics are bitters. Okay, and we'll talk about some examples of stomachics that are not digestive bitters, okay, shortly. Cholagogues and choleretics are related to the formation and the release of bile. And then finally, laxatives affect the bowels. So we'll go through those, each individual actions in a second. But the reason why I'm emphasizing this is if you learn about a herb and it says it's a bitter tonic, then by deduction, you'll know it's going to be a thylagogue, stomachic, cholagogue, choleretic, and a mild laxative. But if you hear that a herb is a thylagogue or a stomachic, you can't necessarily go in reverse order and say, oh, it's going to be a bitter tonic too. It likely is, but it may not be, okay? Now, one of the general warnings that people put on bitter tonics is that you have to use them with caution with people who have heartburn, okay? And the irony with this is that digestive bitters or bitter tonics are often used to treat heartburn. I use bitter tonics almost frequently to treat heartburn. And most of the time it makes it better, but there are cases where it can make it worse. And so if someone had like an H. pylori infection, and that is the primary cause for stomach ulcers, is an H. pylori infection, a type of bacteria that colonizes the stomach and burns a hole through the stomach. And if what ends up happening is because they have this wound in their stomach, when you take a digestive bitter, it stimulates acid production, and as a result, because they have a hole in their stomach and or at least a wound there, it may not be a hole yet, but it can be developed into a hole, and the mucus lining has been compromised in some way, by stimulating stomach acid, you can make that ulcer work, or gastritis, which just means inflammation of the stomach, okay? So it could just be general inflammation, or it could be a specific ulcer. Digestive bitters can make those work. Now with reflux, generally speaking from my experience, 95% of the time, if you give a digestive bitter to someone with reflux, or even 90%, maybe 80% of the time, if you give a digestive bitter to someone with reflux, it usually makes it better. Because in addition to increasing stomach acid, it also tightens up that lower esophageal sphincter. So if somebody's getting heartburn because stomach contents is not being broken down fast enough because it's insufficient digestive juices, and you've got atonic digestion or they've overeaten, then giving a bitter tonic for those cases will tighten up the lower esophageal sphincter, which helps prevent the acid from bubbling up, and that's what reflux is. It also increases saliva, and saliva is also protective against reflux because it helps to coat the esophagus and protect it from getting acid from coming in contact with it. And then it also increases the digestive juices to support the descent of food, to keep it moving along and going down rather than going up. Now, so most of the time bitter tonics work for that, but if for some reason, if you had some anatomical reason why that sphincter is unable to close due to, let's say, scarring of the lower esophageal sphincter, which is the little muscly band that helps prevent stomach contents from flowing up, or if they had a hiatal hernia, which is a condition where a part of the stomach bubbles above the diaphragm, and the diaphragm separates the stomach, the abdominal contents from the lungs. And if you get a little bit of a ballooning up of the stomach up into that area, it may not allow proper closure of that lower esophageal sphincter. And in those cases, a bitter tonic can make it worse. So I always tell people if I'm giving them a digestive bitter and they have heartburn or they get heartburn occasionally, that this should make them better. But if they happen to have an undiagnosed stomach ulcer or some other one of these causes I've described, a hiatal hernia, gastritis, and you can get gastritis from taking medication as well, like ibuprofen and other anti-inflammatory drugs, then it's possible that these bitters can make it worse, okay? So that's a long-winded explanation. We're going to go through this again in 2 seconds and talk about it, but that's bitter tonics. And this is probably, in my opinion, one of the most useful things in herbal medicine is these digestive bitters and the effects they have on all these different systems. You know, is it medicine or is it food? In some ways, it's just an extension of our diet. You know, most of these bitter compounds, I would consider them to be, maybe they're not essential nutrients like a vitamin and mineral is, but kind of, you could argue they are essential in some form because we evolved being exposed to them and that we need them to have proper digestive functions, okay? Or at least it certainly, you may not need them, but it makes your digestive tract work a lot better. So here's a list of important herbs. There are lots of herbs that you'll learn about that are bitter tonics. And like I mentioned, the list is pretty extensive because a lot of herbs have these phytochemicals in them that are bitter. So I didn't list every single one on here. I'm trying to focus on some that I think are going to be important that are going to come up later on. But when you learn about, for example, a herb like feverfew, you learn about more in the nervous system because it can be useful for chronic migraine sufferers, and you take it on a regular basis, it improves migraines. But it does contain a sesquiterpene lactone, and it can be used as a digestive bitter. It's just not my go-to digestive bitter. But, if I happen to have a little heartburn and I was, at my cottage and I know there's feverfew growing in the garden, I'd probably grab a few leaves and chew on it. I mean, I could grab dandelion as well, but that's just an example. And actually, I didn't even include dandelion here. So dandelion is another one that could be on here. Like I can't be covering every single herb at this point, but yes, you can add to this list if there's ones that I've forgotten. Okay. So yellow gentian is important in the liquor industry. So is wormwood, and we'll talk about it later on. It was used in absinthe, type of liqueur that was now banned in most Western countries. Barberry, Oregon grape, golden seal, they all contain similar phytochemicals, and although they're antimicrobials, they're also often used for digestive issues as well. Garden angelica, which is used for respiratory conditions, but it's also used in the liquor industry, has a nice flavor. You'll find it in drinks like chartreuse and some of the other liqueurs out there. Globe artichoke is eaten as a vegetable, but it can also be found in certain liqueurs as well. Cinchona tree, as I mentioned, contains quinine. Quinine is found in tonic water. That's the main source of it now. Coffee, I think everybody knows what that is. And then finally, boldo is another herb that's used, comes from South America, used for digestive issues. Now, if I look at these herbs or these liqueurs, digestive bitters at the LCBO, this is just a few of them. There's lots from all around the world, from different cultures. Campari has that red color used to come from an insect they used to make that coloring, but it's an artificial dye. I don't know what herbs are in here, but it's very bitter. I wouldn't be surprised if it has gentian. I'm pretty confident that unicum, which is the official drink of, I think, Hungary, it's one of the bitterest liqueurs you can get. And I think that the primary active ingredient in that is gentian. The one on the right there is one type of absinthe that you can buy. You can buy absinthe at the LCBO, but they've removed one of the toxic components we'll talk about later on. Cyanide is made primarily from artichoke leaf. Chartreuse has a number of herbs in it, including angelica, arch angelica. A lot of these recipes are secrets, so they don't actually tell you. Jaeger has a whole bunch of things in it. There's going to be essential oils and digestive bitters in that. So those are just some examples. Like I said, I don't know precisely what all the ingredients are in these, and there are some books that they'll talk about. Often it could have a combination of the rind of bitter orange, certain seeds and roots and leaves and berries. But it's pretty cool when herbal medicine kind of gets infused into, no pun intended, into our culture. So these are just a bunch of studies I grabbed. You don't need to know these, but these were some of the ones that I was trying to figure out, elucidate the mechanism of action for a lot of these things. And you can just see that there are compounds, amaragentin and the andrographylide. One's a diterpenoid, the other one's a monoterpenoid. Gentian lutea, that's one of my favorite herbs there. It's talking about how it works in rats. So there is a little bit of studies, but there's no clinical trials showing benefit. There's no clinical trials, period. There's no clinical trials showing it doesn't work, no clinical trials showing it does work. So, the stomachic, pretty easy to remember, basically tonifies the stomach and increases appetite and supports basically the overall function of the digestive tract. So sometimes herbs will say, let's say gentian is also stomachic. It's kind of redundant in my term because I know because it's a bitter, it's got to be a stomachic. So bitter herbs in general follow that category. But to give you a couple examples of herbs that are stomachics that are not bitters, traditional bitters, will be something like marijuana, where marijuana, it exerts its effect on the nervous system to increase appetite and support digestion that way. So it's a stomachic. It does not increase salivation. I think anyone who's ever used marijuana in their life causes dry mouth. That's one of the things. So here's an example of something that is not a digestive bitter and it doesn't have the same herbal actions associated with the other bitters, which are stomachics. Another example is ginger. Now, some books will consider ginger to be what's called a pungent bitter. Now, pungent means that it has heat. So, cinnamon, ginger, galanga, which is Thai ginger, cardamom, pepper. Those are bitter, or those are pungent things. Have that spicy, hot, warming sort of quality associated with it. And so ginger is considered to be a digestive bitter, but it's not actually a true bitter. It's a pungent bitter. So it works by a different mechanism. And I don't think that it necessarily has the same actions as the other bitters. It works by different mechanisms. Probably because it contains essential oils, and it also does have some actions on some serotonin receptors in the gut. So those are some examples. Again, you have to be careful with heartburn with any stomachic, even though it can make it better. Again, caution means just be aware. Doesn't mean you can't do it. Contraindication. There are certain herbs that you just cannot give to pregnant women. That's a contraindication, like you just can't do it. Coffee during pregnancy would be a caution. Yeah, you don't want to overdo it, but half a cup or a cup of coffee probably isn't going to cause any harm. If you have 5 cups a day, though, it may not be ideal for the mother or the baby, okay? The next one is choleratic and cholagogue. So choleratic refers to increasing the release of bile from the liver, okay? Or production and the release of bile. So if you know anything about bile, bile is made from cholesterol. That's where the chol comes from. The chole or cola comes from cholesterol. So retic, so if you think about a diuretic is increased urine production. Choleratic is increased bile production, okay? A cholagogue refers to something that makes the bile go. So the gallbladder stores the bile. When you take a cholagogue, it stimulates the contractions of the gallbladder so that you get more bile spilling into the small intestine. So choleratic means makes more bile. Cholagogue makes more bile flow into the intestine. So I just remember because cholagogue has go in it and it makes the bile go. Okay, that's just a simple little mnemonic for you to remember. Now, in reality, I would say that most herbs that are cholagogues are probably going to be choleretics. And I would say that for the most part, a lot of these cholagogues and choleretics are not always, but often digestive bitters, because all digestive bitters act as choleretics and cholagogues, okay? And so the conditions that you use, these would be similar to the conditions you use digestive bitters for. So primarily indigestion, atonic digestion, but also for conditions like cholestasis. And cholestasis means static as opposed to dynamic. So stasis means the bile is static. It's not moving. And so when people have a bland diet high in sugar, high in carbohydrates, and low in digestive bitters, and they don't drink coffee, they can get cholestasis just from the type of diet, the foods you're eating. And that makes the gallbladder lazy, and as a result, the bile becomes saturated with cholesterol, and that leads to gallstone formation, okay? So usually what happens is people will start getting little small crystals forming, and then those smaller crystals form into, originally, if you just have a whole bunch of little small crystals, it forms sludge. And so you might have on an ultrasound diagnosis having gallbladder sludge. And it just means it's kind of like slush. You know, if you think about what happens before water turns into like a block of ice, it turns into like little slushy like ice particles, okay? And then it leads to gallstone formation later on. So choleretics and cholagogues are used to not just prevent, but also to treat gallstones and to dissolve them. By getting more bile flowing, you basically dissolve the gallstones, okay? And then another indication for choleratic and cholagogues are for conditions, they're often associated with conditions where you might want to detoxify the person. So stimulating bile flow helps to get things moving through the liver and gets rid of stuff. So certain conditions, if someone's just wanting to clean up their overall health, then you could use these things to promote the elimination of toxins. Also, that might be beneficial for people who have, let's say, chronic skin conditions. And often what I see with some cases, not all cases, it may be that their digestion is sluggish and their bowels are sluggish because their entire digestive tract, for some reason, is slowing down and they're not getting rid of quote-unquote toxins fast enough. Now, in some cases, it could be estrogen that's not being released fast enough, so they're basically having estrogens being recycled back in their body, and as a result, it affects hormone levels that leads to increased sebum production and acne and things like that. So detoxification can also be used for hormonal conditions. It can also be used for skin conditions. Might just be used for overall if someone just isn't feeling well. And I know that I think the natural health industry gets criticized for making claims that their products can detoxify the body, but I think there is something to it. I mean, it's not everybody has a huge amount of toxins in their body, but I think definitely drinking more water and taking digestive bitters and taking things that bulk up the stool and doing saunas and sweating and all these things are all important for us to do in general, okay? So phytochemicals, the main ones that I can think of are digestive bitters. I would say probably the parasympathomimetics would also have an effect on the gallbladder, in addition to saliva and some other things, but most of the ones in herbal medicine are going to be related to the digestive bitters. There may be some herbs that have that effect that may have some bitter quality, but they may be working through a different mechanism as well. One of the cautions that you have to have when you're recommending choleratic or choledoc to a patient is if they have gallstones, appreciate it could precipitate a gallbladder attack because you do get the gallbladder working better. It doesn't necessarily cause severe forceful contractions of the gallbladder. It just gets it to work better. It doesn't cause like overexcitation of the gallbladder. Like if you were to go and have fish and chips, I think that would also get the gallbladder working, but it would cause it to cramp up severely, leading to more likely to cause a gallstone attack. So in theory, if someone had gallstones, some books say use with caution. And like it's kind of like with the bitters, use it with caution with heartburn, use it with caution with gallstones. But at the same time, I also use bitters to both treat. It's my primary treatment for heartburn in some cases and gallstones, okay? Now, another action worth mentioning is anti-lithic. So a lith in Latin or Greek or whatever language it is basically means stones. So if you remember, anyone who's studied art or likes art, lithographs are a type of print that they make by taking stone and using acid to etch it to basically burn it, and then they'll apply some kind of paper and they'll make a print from it. So that's what a lithograph is. So an anti-lithic herb basically means anti meaning against, lith meaning stone. It helps break up stones. So anti-lithic herbs are often used for gallstones, but they can also be, other ones are used for kidney stones and gravel in the urinary tract. Those are the two main types of stones that people usually are used for. So most herbs, I'd say most bitters will have an anti-lithic effect. And there are certain ones like boldo, which I was taught as being a classic archetypal herb for gallstones. But other herbs like dandelion, chicory, gentian, they all have an anti-lithic effect as well, even though I didn't list it here. So you can make a little note of that, saying bitters in general. So the way that these anti-lithics work, as I mentioned, is they increase production and the flow of bile. So the anti-lithic effect is associated with the cholagogue and choleratic effect. So if you know a herb is a cholagogue and a choleratic, by deduction, you're going to know it's an anti-lithic for gallstones. Now, there are some anti-lithic herbs that are used for kidney stones that may not necessarily work for gallstones. So, okay. And as I mentioned before, the main risk associated with these cholagogue, choleratics, and anti-lithics is if you're getting bile flow happening, if they had really small stones, it's possible that they could get stirred up and actually end up popping a stone into the common bile duct, and that would become an emergency. Oh, it could be, well, A, it could be very painful. B, if it got stuck, then that's an emergency situation where the person will have to be rushed to the hospital because it could be life-threatening. So I've never had that happen, but that is a risk. And appreciate there's risks in doing surgeries, there's risks in not doing surgery, there's risks in taking herbs, you know. And as long as you get informed consent from your patient and explain to them the benefits and the risks and everything else, then they can make their own decision. There is a herb called Shakapedra, which is used, it's an anti-lithic herb that's primarily used for stones in the, like kidney stones. That's the main thing. It comes from South America. I think it probably would have some actions for gallstones, but it's not the primary one that I use for that, okay? Now, another herbal action associated with bitters are hepatics. So, hepa means filter. Hepatitis means inflammation of the liver. Hepatic herb means basically a herb that's used to promote the actions of the liver. So kind of like a stomachic works on the stomach, hepatic works on the liver. Now, just as an aside, does it help that I give you guys explain what hepa and lith and all these other kind of Latin roots are for cholagogue, choleretic? Does that help you guys, or am I just being like, is it just a waste of time? Because I find I always, when I was learning medicine, I always try to understand what the Latin roots were for these things, where the words came from, because you'd see the repetition. Okay, so it looks like a bunch of people say yes. Good. So hepatic works on the liver. As we know, liver is involved with filtering the blood and used as detoxification. So most of these bitters, often because they increase bile production and bile release, probably will have some actions on the liver as well, directly or indirectly. Some of them could be hepatoprotective, which means it protects the liver, and some of them are going to be cholagogues and choleretics. Not necessarily all hepatic herbs will be bitters, but I would say most bitters, if not all bitters, are going to have some kind of hepatic action associated with it, even if it's not mentioned in it. So where you would have select herbs that are hepatics, it would just be for liver diseases in general, or for if you're trying to activate detoxification pathways. I would say that something like broccoli, for example, broccoli sprouts, which are rich in those sulforaphane compounds that have a positive effect on liver detox pathways, they're not digestive bitters. So that would be an example of a, probably, even though it's a food, it is a hepatic, but it's not a bitter, okay? So for detoxification, liver diseases, so it could be something like fatty liver disease due to alcohol or non-alcoholic fatty liver disease. It could also be things like hepatitis, viral infections. Also, in some of the old herbal books, certain herbs are used for hepatic torpor. And this is kind of a, torpor means laziness, sort of sluggishness. So it's used when someone has a sluggish liver. And so that's kind of a picture of sort of maybe a phlegmatic patient that has the bowels are a little sluggish, digestion function is not good, they have a sallow complexion, they maybe have some skin issues going on. They seem very sensitive to any kind of chemicals. That might be a hepatic torpor. So that's where you might use that. So lots of herbs, milk thistle, turmeric, chelidonium, gentian, chicory. Most of the bitters we talked about are all hepatics as well, okay? Hepatoprotective herbs, like I mentioned, it's pretty easy to do. So once we know what HEPA does, HEPA means liver protective, hepatoprotective. These are things that act as armor for your liver. And there are lots of different compounds that have a hepatoprotective effect. So the flavonolignin that we talked about in milk thistle, and also in barberry as well, in Oregon grape, probably gold seal as well, have these flavonolignin that seem to help protect the liver. Now, curcuminoids, that yellow compound in turmeric, also has a hepatoprotective effect. So giving turmeric to someone with fatty liver or some kind of inflammatory liver disease helps to lower the liver enzymes. But also other flavonoids beyond just those flavonolignin appear to have some hepatoprotective effects. So most of these are going to have an antioxidant, anti-inflammatory effect, or things like broccoli sprouts that are sulfur-based compounds that help to stimulate phase 2 detox also have a hepatoprotective effect. So again, for general detoxification, you might use this. For patients suffering from hepatitis due to viral or chemical insult. Sometimes if people are, let's say, taking a certain medication that could damage the liver, like a chemotherapeutic drug, or I think something like Tylenol, there may be benefit from taking these herbs. Certain types of mushroom poisoning, like Amanita birosa, is the destroying angel that attacks the liver. There may play a role. Some of these herbs may help with that. And then alcohol and other types of drugs, as I mentioned. So again, most bitters will, or some bitters will have a hepatoprotective effect, but I wouldn't say all of them do. Other herbs, so that's milk thistle is kind of a bitter. It's not a very strong bitter, but it definitely has strong hepatoprotective effects. Turmeric is not really considered a bitter at all. It may be a pungent bitter, but even that's a stretch. Licorice does have hepatoprotective effects, and it's definitely not a bitter. Ginger, again, pungent bitter, but it has actions, anti-inflammatory, antioxidant effects. And yellow gentian, there's an example of a classic bitter herb that the flavonoids in it, I think the flavonoids give yellow gentian the yellow color when you look at the tincture. I think those are the things that have the hepatoprotective effect, okay? So there's milk thistle on the left and a beautiful picture of turmeric on the right that I took down in Costa Rica at an organic herb farm. So this is a good spot to stop and take a break. We've talked about the bitters and all the other subcategory of actions that are often associated with those. And now we're going to be moving on to new actions that are not associated with the bitters, okay? So let's take a 10-minute break. It's now 10:40. Let's come back at 10:50, and then we will continue from there. If you have questions, please put them on here for me, okay? All right, you guys, are we back on here? Let me know if you guys can hear and see me, if you guys are back yet. Good to go. Aaron, if you're good to go, I'm good to go. More 60. Okay. So the next action we're going to talk about is carminative. Now, I already mentioned this briefly, I think, in the first half of the term. So what a carminative is, it's a substance that helps to promote digestion and relieve gas and bloating. So in some ways a bitter does this, but they do it by totally different mechanisms. So a digestive bitter, generally speaking, increases the release of your digestive juices, while a carminative is rich in essential oils. And what those essential oils do is they tend to look at, if you take an essential oil and you apply it topically to your skin. So if you take a sport cream like A535 or Tiger Balm, you apply it to your skin, what it'll do is it'll cause your skin to turn red. And the reason why it does that is slightly irritating, and it basically causes the capillaries to dilate to increase blood flow to those areas. So when you take essential oils internally, and essential oils like menthol, even eucalyptus to some degree, but there are lots of other essential oils that you might get in any of the members of the peppermint family or the carrot family, like fennel anise and things like that. Those essential oils will do two things. One, they'll increase blood flow to the stomach, and that will help to help with digestion that way. The second thing they'll do is they tend to relax smooth muscles. So they relax the capillaries to cause them to dilate, and they also relax smooth muscles. And by doing that, if there's increased cramping going on in the intestinal tract, it helps to kind of relax and normalize the peristalsis to relieve cramping. And so if someone gets gas, let's say if you eat a whole bunch of beans or you have digestion, you just overate and you're feeling kind of heavy and gassy, it'll relax the smooth muscles to normalize the peristalsis, but also relax sphincters. And you've got sphincters in various places in your intestinal tract, and those muscular bands, kind of by relaxing them, you can allow for gas to be expelled out of the body, or also for food that's in the stomach. If you relax the sphincters, it'll drop down a little bit. So bitters tend to tighten up sphincters. Well, normalize, tonify. They don't necessarily hype, like they won't cause it to unnaturally tighten up too much, but it tends to tone it, while carminatives have more of a relaxing effect. And so the benefit of that, if you've got a lot of bloating and gas and trapped in gas, if you have a bunch of peppermint tea or fennel tea, even chamomile to some degree, it'll help to relax those sphincters and allow you to pass the gas. The other thing it does is that by increasing blood flow to the intestinal tract, you're probably going to absorb some of it into your blood, maybe expel it through your breath, but I doubt it's that significant enough. So if you're sitting in the classroom, you just had like a bean burrito for lunch and you're feeling kind of bloated and gassy, the treatment for that would be have a cup of peppermint tea, but then go for a walk. You don't want to stay in that classroom. So have the peppermint tea, relax those sphincters and get out of there, and go for a little walk and let that gas come out, and then you can go back and feel better, okay? So carminatives are used for indigestion, but they kind of have this weird little opposing action. So for indigestion, yes, they can get food to descend by relaxing those sphincters, but they can also get food to spill up. So you got to watch it in cases like heartburn, okay? You can also give carminative to people who have a colic. So a colicky baby is a fussy, miserable baby. And to be honest with you, most babies that are colicky, and they're crying all the time, they're miserable, they're not just bad children. They're not just being difficult on purpose, they're in pain. And most of the cases, it's because they have some kind of food sensitivity, and giving a carminative can help relieve the cramping pains and the distension, the bloating they have, okay? More importantly, identify the food sensitivity. So flatulence can be used for that. IBS, these can be useful because often with certain types of bowel issues that people have, even if it's diarrhea or constipation, they both can be associated with some cramping pain. And so Carminative is going to have a relaxing effect and make you feel better. So the essential oils are the main constituent that have the carminative action. And you can take it as a tea. You could take some of these things in tincture form, or you can buy encapsulated peppermint oil or even oregano oil. The essential oil can be used as a carminative as well, although it's a bit nasty to taste. But if that oregano oil that people keep in their cupboards for infections, yeah, if you felt kind of bloated and distended, that can help with that as well. So peppermint oil, peppermint tea. Fennel is a great one as well. So for example, if you were to have ouzo or zambuca, which usually is made from fennel and quite a bit of sugar as well, that's often given after meals if someone's feeling a little bloated to help them relax. Now, the only problem with zambuca, I remember, as I mentioned before, I don't normally drink hard liquors, but occasionally, sometimes with certain functions, I will. And I remember someone gave me we ate a big meal, and then I had a bunch of Zambuca, kind of shot of it after dinner, a pretty large shot, and then went to bed. Basically, I was laying down, sleeping, and I guess I must have burped in the middle of the night, and all this acid just spilled into my mouth, and it woke me up because it was so painful and all this strong acid. And that was from the essential oils and the fennel and the anise basically relaxing those sphincters. And there was a big pressure buildup because I overate, which I don't generally do. Combine too much pressure and relaxing sphincters and then laying down on your side or on your back. That's all the perfect storm for getting pretty bad reflux, okay? Another one is ginger. Ginger has essential oils in it in addition to the gingerol, which is a phenolic compound, very large one. I don't know how much of that's in the essential oil component of it, but it does have other essential oils in it that act as carminatives as well. And then finally, chamomile. It has a carminative and an antispasmodic effect. The antispasmodic effect can be associated with other things, but the carminative, there are essential oils in chamomile that have that beneficial effect. So all these can be combined to make like a colic formula. For children, just watch the ginger. Some kids find it a little bit too spicy for them. And there you go. So as I mentioned, how do they work? Increase blood flow to the intestinal tract, relax smooth muscles, especially those sphincters, and they can normalize peristalsis. And also, don't drink a bunch of Zambuca and then go to bed shortly afterwards if you've overeaten, because you will get reflux. Okay. There's peppermint. So other members of the peppermint family are also rich in essential oils, and that would be things like spearmint, lemon balm, oregano, thyme, rosemary, and then other members of the fennel family or wild carrot family include anise, cumin, caraway, what else? Coriander. So most of the culinary spices that you have at home, if you had a little bit of bloating and kind of you felt distended and cramping, just grab a teaspoon of those seeds and pop them in hot water and make a tea with it. Fennel's great for that. And there we have a study that's talking about the benefits of peppermint oil capsule for relieving IBS. Now, I'm going to keep reminding you, the cause of IBS is not a peppermint oil deficiency. The cause of IBS is probably going to be food sensitivities combined with dysbiosis, meaning the bugs are kind of wonky. And so, although I do use peppermint oil capsules, it's not the cure for it. The cure is removing the cause, okay? So carminatives have that action, kind of a normalizing, relaxing effect. Now, antispasmodics or spasmolytics. So, this is where you can have a synonym. Lytic means lysis, means to break apart. So, spasmolytic means to break apart spasms. you could use those interchangeably, no problem. And these will be used as similar mechanisms that you might use a carminative, but carminative is more used to promote digestion. And antispasmodics, there's some overlap here. It might be used when the cramping is more severe and causing discomfort. And so many carminatives have some antispasmodic effect, but a strong antispasmodic effect might not be associated with the essential oils. It may be associated with other alkaloid-like compounds, for example. So not all carminatives most carminatives have some mild antispasmodic, but not all antispasmodics are carminatives, okay? So I would say all carminatives are essential oil-based, while the antispasmodics can be associated with other compounds as well. Now, members of, for example, opium, the plant, it contains certain alkaloids that have a strong antispasmodic effect. It shuts down peristalsis. And so one of the side effects from smoking opium or from ingesting opium as a pain medication like Tylenol 3s or some other type of opiate is constipation as a side effect. So people on a lot of pain medications that are opioid-based often will get constipation associated with it. And that's because it basically shuts down that peristalsis. So you're not going to get spasms, generally speaking, if you shut down the movement of these smooth muscles altogether, okay? Now, greater chelidine, or Chelidonium majus, which is shown on the right there, it contains isoquinoline alkaloids. It's a cousin of the opium poppy. I would say that you're probably not going to get any major analgesic effect. I mean, there's some slight analgesic effects, but you're not going to get major ones like you would from poppy. But it does, the compounds in it are latex, found in latex, just like how opium contains latex. Chelidonium or greater chelidine contains a latex-like substance that's rich in various things, including isoquinoline alkaloids, which have some overlapping similarities to what you find in opium poppy. So greater chelidine is used historically for colic of the digestive tract. Also menstrual cramps can be used for where you have cramping of the uterus, but it's used mostly for like cramping gallbladder issues and IBS-like stuff conditions. Wild yam, it does not contain. Well, I don't want to say it doesn't. I don't think alkaloids are its main action. It has wild yam, sometimes called colic root, and it can be used. I use it in Gallstone formulas. It also has benefits for lowering cholesterol and doing a few other things. It's considered an antispasmodic or herb, and both of these I would say are relatively void of essential oils. There could be some in there. I wouldn't be surprised, but that's not the main action. Okay. Other things like marijuana, deadly nightshade, they have. Oh, I'm on the wrong thing. Another antispasmodic, which I didn't mention here, which, sorry, I'm bouncing all around on you guys. You know what? You could easily, I would say, take this guy. I would put it there as well. Deadly nightshade contains atropine. And atropine, we don't use these in herbal medicine. I don't think I've ever used deadly nightshade in practice. I could use it, but because it's a little bit dangerous, and I don't know, actually I don't know if the board allows us to use it or not, but if someone came in and they had severe biliary colic and there was not a hospital down the road and I was only a doctor around, I would use deadly nightshade for sure for that patient to help to relieve the cramping pain. And because it works as a anticholinergic, it basically blocks the parasympathetic nervous system. And if you remember, parasympathetic nervous system, when you stimulate it, it gets things moving in the digestive tract. And when you suppress it, both opium and deadly nightshade will suppress that action. Very strong drugs, and the herbs are very strong. That's one of the reasons why we don't use it. So but it is in that category as well. Wild yam I use all the time. Chamomile I also use. I think in addition to the essential oils, some of the flavonoids seem to have some antispasmodic or spasmolytic effect. And so flavonoids, for example, thyme is a herb often used for cough formulas. It has essential oils in it, but the main spasmolytic compound or antispasmodic compound that's used makes it indicated for cramping, like a spasmodic cough, is, I think, the flavonoids that are in it, not the essential oils. I used to think it was essential oils, but I did a little bit of research, and it turns out they both may play a role in that, which is kind of neat. Let me see. Carminatives, like I said, carminatives have some antispasmodic effect, but they're not strong antispasmodics. So a book may or may not list something like chamomile or peppermint as an antispasmodic. It may only list it as a carminative. So Bianca's asking, how often would you take the tea a day to have an effect? I'm not sure which tea we're talking about now. I'm assuming chamomile. Depending on what's going on, you might just take it once acutely as needed, or you could drink it 3 to 5 times a day, depending on what you're using it for. Someone's asking, when will the grades be released and where can I see them? That is something that I don't have any responsibility of. I've already done my job. I've approved the marks last week, and they've been submitted to academics. Okay? So we already mentioned that earlier on. You must have missed that. So moving along, antiemetic. So emesis is vomiting. So an antiemetic is something that suppresses nausea and the vomiting reflex. And so the main indications for this would be nausea and vomiting associated with other conditions like morning sickness with pregnancy, also with motion sickness or travel sickness, and chemotherapy. And there's research to back up a lot of these herbs. The archetypal herb used as an antiemetic is ginger. And so if you go into the drugstore or even I've seen it at gas stations, Gravol, which the original Gravol is an antihistamine-like compound that's you could use it for seasonal allergies. You could use it; it makes you sleepy as well. It's the same thing as Ignitol, but it's also an antiemetic. Through blocking muscarinic receptors, it has that anti-nausea action. But in addition to that, they have a natural Gravol, and it basically is a standardized ginger extract. And it works. And there's a lot of research that shows that that ginger works for a number of conditions involving nausea. Now, other herbs, for example, peppermint, also seems to have some benefit for relieving nausea. And I would say even getting something like Altoids, like the candy, and just eating a peppermint candy can sometimes relieve nausea. Or even just smelling the peppermint oil, essential oil, can help settle the stomach. Marijuana, which is working by totally different mechanisms than the other ones, has an antiemetic effect and is often used for people if they're going through chemotherapy to suppress nausea and improve appetite. And then deadly nightshade and other herbs that contain tropane alkaloids that act as anticholinergics can help settle the stomach. So a drug called Scopolamine can be prescribed to people with severe motion sickness. So when you look at, in practice, if I'm looking for an antiemetic, ginger is the primary thing that I would use. The only reason why I might not use ginger is that if someone found it to be too spicy, and ginger, you got to watch it when you have an alcohol extract. It can be really, really spicy sometimes. So peppermint is sometimes a good alternative. I don't think it works as well, but it's pretty good. Ginger works by blocking specific serotonin receptors in the gut to have that antiemetic effect. So when you look at serotonin, as we talked about earlier on, it's involved with mood regulation, it's involved with heat regulation. It's also involved with digestive function and peristalsis. And so, for example, when you take when somebody takes ayahuasca, when we talk about that, where you get the hallucinations, that's related to the serotonin receptors. When you get the nausea and the vomiting, that is a normal effect because it also stimulates these 5-HT3 receptors that are involved in nausea. So so the ginger, by blocking the 5-HT3 receptors, it has an antiemetic effect. While ayahuasca, by stimulating those receptors, has an emetic effect, which stimulates emesis. So cannabinoid receptors in your body, those are another type of receptor that you have that you can stimulate to have that effect, to have the positive effect. So you block the serotonin receptors involved with nausea, or you stimulate the cannabinoid receptors. And then finally, muscarinic receptors in your parasympathetic nervous system. Too much activity of these leads to cramping, nausea, vomiting, diarrhea. Suppression basically leads to decreased nausea and vomiting, but it also, as a side effect, will have basically cause constipation. Okay? So there's ginger. You can buy it pretty much anywhere. I recommend you buy organic ginger. Apparently, stuff comes from China, it tends to be heavily fumigated. But you can buy it fresh. You can buy it in powder form. The powder form will work just as well as fresh ginger does. I like both. I have both in the house. There's marijuana. It can be ingested. You know, there's all sorts of ways you can get marijuana in the body. Now that it's legal, you can actually prescribe it to patients. I mean, I know they can get it for free, but there are places where you can prescribe it and for medicinal purposes in addition to using it recreational. Here's a couple of studies just talking about the benefits of peppermint oil, the volatile oils of it taken internally or just inhaling it to reduce nausea. So that's a great option for someone who's going through surgery where they say, look, you can't eat or drink anything but water. They could just have a little thing of peppermint oil that they can just smell. Or if they're traveling, they could smell that and can relieve the nausea. Okay? So an emetic is the opposite of an antiemetic, and that an emetic is something that induces vomiting. Now, this is not something that I've ever deliberately wanted to use. Sometimes in the old early herbalists, for example, Samuel Thompson, he would often want to get people to cleanse. He was big into giving people cayenne to stimulate circulation. He also gave them Indian tobacco, which basically stimulates emesis to get people to vomit as like part of their detoxing. That's kind of fallen out of favor. I do think that when you purge out your insides and you kind of get everything out of you, people feel better, and it does have some detoxifying effects. But I have never asked my patients to do that. Certainly when I've done ayahuasca, I've just had you doing the vomiting, and that seems to have a cathartic and cleansing effect, but hard to talk a lot of people into doing that. So in general, where you might use an emetic in theory is if someone came in, let's say if you had no drugstores, no hospitals around, and someone came into your practice and said, my kid just ate a bottle of Tylenol. What do I do? You know, in addition to calling poison control and trying to induce vomiting manually, you could give an emetic herb to get them to purge it out. And so syrup of ipecac can still be found in most pharmacies, and that would be the treatment you would give for someone who's taken a non-corrosive substance that's poisonous. Okay, if someone drank bleach or something, that you don't induce emesis, they do something else for it. So although they may be moving away from using these, maybe they're doing pumping people's stomachs and stuff now, but that was what was used historically. So ipecac, or syrup of ipecac, I've never used it in practice. I've taken photographs of it, which is the photograph on the right-hand side. This is what it looks like in the wild. And emmetine, which is the alkaloid in it, is responsible for causing emesis. Indian tobacco, it is on my shelf in my clinic. I use it more for as an expectorant for serious respiratory conditions where there's a lot of phlegm and asthma associated with it. I don't use it a lot because it does cause nausea in some people as a side effect if you exceed a certain amount. And if they take more than the recommended dose, it will cause vomiting. Okay. Jabarandi, again, that's a herb I don't use in practice, but because it stimulates the parasympathetic nervous system, it can be used to induce emesis as well. But appreciate, these are not actions we tend to try to get in practice. Like, we just don't. You could. If we were the only doctors around, then this would be more important probably. But again, it's rare that you would deliberately want to do this. But it's worth knowing that Indian tobacco, which you may be using for respiratory issues or for to help people with substance abuse addictions and stuff, the piperidine alkaloids induce vomiting. In Ipecac, it's a type of isoquinoline alkaloid that does it. And then the Jabarandi, it's the imidazole alkaloids. Those things aren't really as important right now to remember. And in this case, it's either stimulating directly muscarinic receptors, or there's a spot in the brain called the medulla oblongata, which is responsible for vomiting, and that's sort of the area where some of these things will stimulate. So, an anticholinergic, we discussed this. We don't use these a lot in practice. Some of the herbs might have some mild anticholinergic actions associated with it. But if you remember from the slides I showed you before, if you stimulate the parasympathetic nervous system, it leads to nausea, vomiting, diarrhea, lacrimation, urination. All of your fluids are flowing when you take that, including stomach acid and bile. So if you suppress those things, it could be used as an important drug for suppressing things like diarrhea. So an anti-secretory effect for people with diarrhea, or even like a really bad stomach ulcer where they're in a lot of pain and you want to basically block stomach acid production. Could be used for that. If someone had severe diarrhea where there's a risk of dehydration, potentially you could use something like this. Or if someone had really bad some kind of GI infection where they had vomiting and diarrhea and they're in a lot of discomfort and pain and spasming, you could suppress it. A lot of the drugs like loperamide or what's it called? The drug for diarrhea. Loperamide's the name of it, but just slipping my brain. A common drug that's often recommended for travelers' diarrhea to suppress the diarrhea. No, not Imodium, thank you. Imodium, the way it works is it basically has, it works as an opioid and has sort of an anticholinergic effect through some of those opioid-like effects. So, and in the old, so you could use things like opioids or these anticholinergics directly to have that effect. Now, the two classic herbs would be deadly nightshade and also Jimson weed. And they have been used, or extracts have been used, or the active compounds in it, the tropane alkaloids have been used for motion sickness, like scopolamine, which is also found in Jimson weed for motion sickness, also for some types of nausea and vomiting, which is not really the main drug of choice for those. They use other drugs because the side effect profile is too significant. And then also with severe colic, if someone was passing a gallstone and they're in a lot of pain, these would be a class of drugs that potentially could be used, but they're not really used that often. So there's deadly nightshade on the left, and there's Jimson weed on the right. Powerful drugs, but they got a lot of side effects, so not used often. So, another group of drugs, or herbal actions that are useful, are demulcents. Demulcents don't exist in the pharmaceutical world. Unlike the anticholinergics, these are kind of exclusive to just the herbal world. Or, at least I don't think these are used in the pharmaceutical world. So demulcents, what they basically do is they are used to soothe dry, irritated mucous membranes. And they can do that by a couple different mechanisms, and I'll talk about that in a second. So your main indications from the digestive tract is if you have something that's bugging, where there's inflammation of your mucous membranes, and those are basically the tube that goes from your mouth all the way down to your anus is a mucous membrane, okay? So if you have heartburn and there's a lot of acid bubbling in the esophagus, demulcents can be taken to basically help coat and soothe those mucous membranes there. If it's in the stomach and you have gastritis, gastritis means inflammation of the stomach. And that can be another cause. So heartburn can result from either reflux or gastritis or a stomach ulcer. Those may see benefit from taking a demulcent. If someone has colitis, that means inflammation of the colon. So itis always means inflammation of. So bronchitis is inflammation of the bronchioles. Gastritis, inflammation of the stomach. Esophagitis, inflammation of the esophagus. Cystitis, inflammation of the urinary tract. So whenever there's an itis in it, and it refers to a mucous membrane, maybe not arthritis, but if it refers to a mucous membrane, demulcents could potentially be useful in soothing and reducing pain and symptoms associated with it, okay? So sometimes when people have a urinary tract infection, demulcent herbs might be added to that to soothe so it doesn't irritate as much when the person's urinating. Or if there's a dry, irritated cough, you might take a respiratory demulcent for it. Okay. The phytochemicals that are associated with it are often carbohydrate-based. So mucilage or slimy water, you drink it, it just kind of coats it, physically will coat it. Same as the gums and the gels. So herbs like marshmallow and slippery elm are rich in slimy, mucilaginous, fiber-like substances that kind of coat and protect. And there's also certain things like flavonoids that can have a demulcent effect. And now flavonoids, they don't form a gel or a viscous solution. They work by a different mechanism. And so looking at the mechanisms, marshmallow and slippery elm, which are rich in mucilage, gums, and gels, those types of things, basically, it's like you're supplementing your body with mucus or mucilage, okay? So when you supplement it, if your body's not making enough, then you basically drink it and it coats and protects. Another way that you can have that effect is by, instead of directly coating it, indirectly, you tell your body to make more mucus. And so herbs like licorice contain certain flavonoids that have been known to stimulate the production of certain prostaglandins involved with mucus formation. So what's neat about licorice is there's a few different types of licorice on the market. Licorice contains a flavonoid, a special kind of flavonoid called a lycoflavone, okay? Now, to give you a little backdrop, if you take aspirin, ibuprofen, or any of the other non-steroidal anti-inflammatory drugs, the way that these guys work is they block cyclooxygenase 2, or COX-2 is an enzyme involved with inflammation in the body. And by blocking that, you decrease pain by suppressing the prostaglandins, little chemical messengers involved with inflammation and pain. But the problem with these non-steroidal anti-inflammatory drugs is they also target cyclooxygenase 1 enzyme, or COX-1 enzyme. And this COX-1 enzyme is not involved with inflammation per se, but it's involved with maintaining the integrity of the intestinal tract. And some of the prostaglandins that it's also involved with some other things, including contractions of the uterus and some other stuff, okay? So what happens when you take an anti-inflammatory drug, a lot of them, is they suppress the prostaglandins that are involved with inflammation, but they also suppress the prostaglandins involved with telling the intestinal tract, the mucous membranes, to produce mucus. So the reason why aspirin and ibuprofen and these other non-steroidal anti-inflammatory drugs are so bad is because if you reduce mucus formation, that means that you're more likely to get a stomach ulcer. That's one place. So by affecting these prostaglandins in the stomach, you're more likely to get a stomach ache, some heartburn that can lead to an eventual ulcer, which could be life-threatening and a bad thing, okay? Something that's more recent is they also have been shown to play a role involved in maintaining the integrity of the intestinal walls. And so when you take a lot of these anti-inflammatory drugs, they can basically cause the cell walls to become leakier. And people can develop leaky gut syndrome if they're doing a lot of these anti-inflammatory drugs. Okay, so that's the backdrop. So what's cool is, so if you were taking a lot of ibuprofen and you were getting stomach aches, drinking, let's say, slippery elm or marshmallow tea could help to coat the esophagus and reduce the damage. But you could also take licorice extracts that elevate or stimulate the production of these prostaglandins, the PG2 and the PGF2 alpha, which is involved with making the mucus production. So taking a licorice extract with these anti-inflammatory drugs reduces the risk of developing stomach ulcers. And you can also take licorice extracts for heartburn in general. Now, as an aside, one of the compounds in licorice called glycyrrhizin, that's the triterpenoid saponin. Okay, so when you look on the left, the saponin that makes it all bubbly. That triterpenoid compound has a lot of important medicinal properties associated with it, but that's not necessarily what we're looking for if we want to stimulate the mucus. The lycoflavone, this interesting flavonoid-like compound, is responsible. So they produce products on the market called deglycerinated licorice extracts, DGL extracts, which can come as a tablet that you can chew, or as a capsule that you can take, or as a powder. And it's that compound that is beneficial for the ulcers. The glycyrrhizin, yes, has benefits for adrenal fatigue and some other anti-inflammatory things in itself, but it has the side effect of jacking up blood pressure. So the DGL does not raise blood pressure, but can help with stomach ulcers. It won't be useful as an adrenal tonic. It probably isn't going to be the main thing that can have a positive effect on as an antiviral and some other things. But if you're only looking at preventing stomach ulcers and helping with heartburn, then you can take a DGL extract and you don't have to worry about the blood pressure concerns you would get with the licorice extract. Now, again, everything's dose dependent. Taking it short term from time to time, I'm not worried about. But if someone was doing it, for a few weeks on end and they had a history of high blood pressure, you definitely wouldn't want to give them licorice. You go with the DGL. Okay? Does that make sense to you guys? I'm going to summarize it really quickly. Non-steroidal anti-inflammatory drugs, bad for your stomach and your intestines because it compromises mucus production. So it leads to stomach ulcers and leaky gut. The antidote is taking DGL, which won't raise your blood pressure and stimulates mucus production by targeting those same prostaglandins that get suppressed by the non-steroidal anti-inflammatory drugs. It helps to stimulate it. Does that make sense to you guys? Or I don't know if I did a very good job explaining that or not. Good. Okay. So, anti-ulcer or anti-ulcerogenic herbs or gastroprotective herbs all help to prevent stomach ulcers. Now, there are different types of ulcers you can get. You get ulcers on the inside and ulcers on the outside. Some of the ulcers that you get in your stomach won't necessarily respond, or some of the topical ulcers may not necessarily respond to the herbs you might take internally. For example, I wouldn't use DGL for a leg ulcer. But some of the herbs used for treating leg ulcers can also work for peptic ulcers or ulcers in the colon as well. Now, there are other actions that kind of may be associated with this anti-ulcer effect. So increasing mucus production, that's going to help heal these ulcers up. Also suppressing stomach acid, that's another action that if someone has too much, or maybe not too much stomach acid, I'll come back to that later on, but if someone has a lot of stomach acid, may interfere with the healing of the ulcer. Vulnerary is a new action we haven't talked about yet. It basically speeds up the healing of any kind of wounds. Astringents can also be used for treating ulcers by forming those phenolic compounds in the astringent herb react with the exposed proteins to form a cross-link and kind of make a second protective barrier skin that gives an opportunity for that ulcer to basically heal. So it kind of produces like a little shield over top of it, allowing for the deeper tissues to heal. And then finally, a lot of these ulcers, there's a lot of free radicals being generated that leads to further damage. So a lot of them have antioxidant effects as well. So there's lots of different mechanisms of actions, and some herbs will have an overlapping effect here. Now I want to show you, here's a herb that comes from the Amazon. This is called dragon's blood. This is a latex that comes from a tree called Croton letri. And this is important to note that there are herbs in Chinese medicine called dragon's blood. That's a different plant altogether. It's a different genus and species and family altogether. So a drug called dragon's blood and TCM is not necessarily the same as what I'm talking about here. Now, here's a patient who had leg ulcers. Now, this dragon's blood is used for ulcers in general. It can be used internally and topically for ulcers. So internally, they'll use it for stomach ulcers and colitis and some other things. And topically, it can be used for wound healing as well. And so this guy had venous insufficiency. Basically, he had poor blood flow in his legs. Doctors can't do anything about it. These ulcers will crop up from time to time. They will have difficulties healing. The risk is that if they become infected, he could actually end up losing the leg. And he was seeing medical doctors, and they didn't really offer much for him. And I'd just come back from the Amazon. I had a bunch of this dragon's blood with me that I gave to him. And the dragon's blood has a few different compounds in it. It's very, very rich in tannins. And so that red is due to some of the anthocyanins in it. And I think there are some other interesting compounds in it. But when you apply it topically, this is a picture before. And you basically take the liquid. It comes in like a bottle. Apply it topically to the wounds. And that's what it looks like afterwards, within 30 seconds or whatever. It literally just seals up these ulcers and basically helps protect them. So now any kind of microorganism is not going to be able to basically come in contact with that exposed skin there. And it's going to give it an opportunity to heal. And these were pretty life-changing for this guy. Where he'd apply it, and it would just give an opportunity. These ulcers would heal. Now, the only problem is the root cause, which is the veins in his legs were messed up or whatever was going on. It didn't cure his venous insufficiency, but it would heal these ulcers, and then these would eventually heal up and go away, and then he might have another one appear somewhere else, so he'd apply it to. So he was constantly having to chase these leg ulcers with this dragon's blood, but it worked really, really well. So the reason why I'm giving you this picture is stomach ulcers would respond in a similar way to these things. And the main compounds in this, the actions associated with it, are astringent compounds that help to form the second layer of skin, and also there are some vulnerary compounds. Now, I find dragon's blood's pretty hard to find in Canada. I think eventually it'll become easier to get. But in Central and South America, it is a widely cultivated plant for a few things, including diarrhea and ulcers. So there's an example of what it looks like. I think it's pretty cool. What do you think of that? You guys think that's pretty cool? I think it's pretty cool. Do you like these pictures? So, yeah, and if you had a cut, you could just apply it topically, and it would help to arrest the bleeding. I don't know how long the shelf life is on that dragon's blood, because I found after a while the tannins started, kind of like with wine, how wine, you get a little bit of a deposit after it's been sitting on the shelf for a long time. It starts to precipitate out. Those are the tannins. So vulneraries, usually we think about vulneraries as being associated with skin conditions. For scabs and wound healing, burns, things like that, where there's damage to the tissues. So you can use them topically, but you can also use them internally for inflammation and mouth sores, stomach sores, maybe ulcers like ulcerative colitis, things like that. Some of the herbs that you use topically can also be used internally as a vulnerary. So chamomile is probably one of my favorite herbs because it's so easy to take. And it's a classic remedy for stomach ulcers, but it can also be used topically for skin conditions. So it may be in certain moisturizers or skin creams for wound healing, sunburns, eczema, things like that. Yarrow is a herb that has similar phytochemicals that you get in chamomile, but it has more of an astringent action associated with it, and it's used to arrest bleeding as well, but it does have wound healing properties. And it was used by the ancient Greeks for like battle wounds and lacerations and cuts and burns to stop bleeding and to speed up the healing. Marigold is a classic remedy, first aid remedy for burns and cuts. It doesn't stop the bleeding, but it helps speed up the healing of the wound, and it can be used for ulcers, both internally and topically. And then English plantain, there's a few different species of plantain that can be used, but it's used for both internally and topically for wound healing as well. And I think the way it works is a lot of these things will modulate inflammatory reactions. So kind of like what we're talking about with phytoestrogens, it doesn't necessarily stimulate or block. I think it modulates it. So it does have a little bit of an anti-inflammatory effect, but inflammation is also involved in part of the healing process. So suppressing inflammation isn't always the best thing to heal it. So you may have to modulate inflammation in general, okay? So both chamomile and marigold or pot marigold or calendula are members of the Asteraceae family. They have that classic, when I think of a flower, that's what I think flowers look like, right? These both contain, there's some essential oils, they both contain, they're going to have flavonoids in it, they're going to have some sesquiterpene lactones. Marigold has triterpenoids that are responsible for its anti-inflammatory effect as well. Now with astringents, astringent herbs we mentioned already are things like oak, crane's bill is another one we didn't talk about, witch hazel is another one, blueberry, bilberry have non-hydrolyzable tannins. The dragon's blood also would fall into this category. And so astringent compounds basically help to form that second layer of skin. So when you apply to a skin where it's been cut or there's a wound or there's an ulcer, it'll go in there and kind of help tighten up the skin. It forms that complex where it forms like a cross-linking and helps to pull the skin together. So astringents are often used topically if someone, let's say, cut themselves shaving. You apply this astringent herb to it and it tightens it up and stops the bleeding. So skin toners are usually astringent. It kind of has that, makes the skin feel tight, okay? Internally, when you apply these astringent compounds, it alters the mucous membranes. So you'll notice, like if you eat a green banana and your mouth starts to pucker up, those are the astringent compounds in the green banana, kind of forming cross-linking with the mucous membranes. And that'll have an anti-secretory effect to some degree because it's going to target some of the transporters and proteins involved with generating saliva, stomach acid as well. And also, if you have an exposed wound, astringents have a much greater affinity for exposed tissues than most. So if you have a cut or an ulcer, they have the greatest effect on that. And then mucous membranes to a lesser degree. And then your skin that's like just normal skin on the outside it's pretty resistant to them. So it's less, you don't tend to have as much of a thickening effect of that as you do to more of the exposed tissues and the mucous membranes. So astringents are used primarily to help with wound healing, especially with lacerations, also bruises. People have varicose veins, hemorrhoids, that can be applied to that to tighten it up to make them better protected. Also, astringent compounds can help with diarrhea because they have an anti-secretory effect. Because tannins will tan animal hides to make them thicker and more resilient to stress. If you take a lot of astringent herbs internally, it does alter the mucous membranes and starts targeting some of those proteins that are used as like transporters in the body. Like most of those enzymes, transporters, things like that, they're all protein-based. So astringents can denature them and make them ineffective and also form cross-linking in the intestinal tract. And that can decrease secretions like stomach acid or also the active pumping of sodium into the lumen of the bowel that causes diarrhea. By inhibiting those, you're having a very strong suppressive effect that can sort of block that. But as a side effect, it can also affect the reabsorption of desirable things. So You don't want to overdo the astringents internally because it can definitely cause A, some stomach aches, and B, have a very strong suppressive effect. But in some cases, small amounts would be indicated as well. Also with diarrhea, often parasitic toxins are usually protein-based that cause the diarrhea. And so taking astringents can bind up the bacteria, the parasite proteins that are responsible for the diarrhea and inhibit that way as well. So Cranesville is a herb that's often used internally for various strong inflammatory issues in the bowels. I don't tend to use witch hazel or oak, but it could be used. Bilberry is pretty general. It's often used for kids with infantile diarrhea. So in your stomach, normally I don't like to suppress stomach acid. I like to support it. So most people who have heartburn, it's not because they have too much stomach acid, it's because acid's going in the wrong place. And that's why I tend to work more with bitters and demulcents to try to protect mucous membranes and also to keep food in the stomach and descending rather than coming up. But there are cases if someone had a stomach ulcer because of antacid or because of ibuprofen or other kind of anti-inflammatory drugs or a stomach ulcer due to a H. pylori infection, you might want to suppress the stomach acid for a little bit just to give it an opportunity to heal. So short-term antacids are beneficial. Long-term taking antacids, especially the drugs, are associated with all sorts of bad things, including, well, now they're, anyways, so a whole bunch of things we'll talk about later on. So the classic herb that has an antacid effect is meadowsweet, or Filipendula ulmaria. And I would say that is the archetypal antacid herb. So if I need an antacid, that's the one that I go with. So if I had someone come in who had a lot of inflammation of the stomach and digestive, and they're in a lot of discomfort, and I was a little bit concerned that giving gentian could aggravate things, I might be inclined to use meadowsweet and some other herbs. Cranesville, which is an astringent compound or astringent herb, very, very astringent. It also has some antacid properties to it. I don't use that one as much because it's a little bit too strong for some of the things that I need, but you could use it for that. So meadowsweet is often used for heartburn or even reflux, maybe short term, but I wouldn't. It's not my main go-to for reflux, but for gastritis and inflammation of the stomach, it would be a good one to go with. And so we know that, for example, Cranesville, because of the tannins, it appears to directly affect the acid pumps in the stomach. So the hydrogen potassium pumps that are responsible for increasing stomach acid or for making stomach acid, I think these tannins just go in there and denature them and prevent them from working. And so that's one way they work. Meadowsweet, it does have some tannins, so it may work by that way as well. But another thing that it does is it appears to inhibit an enzyme called histidine decarboxylase enzyme. And histamine is a secondary messenger for making stomach acid. For some of the acid blocking drugs, they are called H2 blockers, and they suppress stomach acid by blocking the histamine receptors that are involved in signaling the production of stomach acid through the hydrogen potassium HTPase enzyme. So meadowsweet, one of the ways that it works is it actually prevents the conversion of histidine, which is the amino acid, which is the precursor for making histamine. So that's just kind of, I just like to explain how these things work if I can find the mechanism. So that's why meadowsweet, in addition to it does have some tannins, a little bit less astringent than the Cranesville. It probably works by a couple different mechanisms, okay? Someone's asking, is Tums considered an antacid? Yes, Tums, the way that Tums neutralizes stomach acid is you're giving a buffer. So usually I think it has calcium carbonate, which when you add it to acid, it releases CO2 gas and raises the pH. That's how it affects it. Zantac is going to block acid production. So it's also an antacid, but it's more, rather than neutralizing stomach acid, it blocks the production, okay? Someone's asking about frankincense. Frankincense has lots of good properties. I don't know if it's an anti-ulcer though, but it has some great properties to it. Let me check my time. Okay, 11:46. So I think that's probably a good place to end. Next week, what we'll do is we'll talk about different types of laxatives, because that's a whole group of actions we want to talk about together. And we'll talk about things that can be used for constipation and sluggish bowels. Then we'll talk about things that can be used for diarrhea. We'll talk about a few antimicrobials and then some anti-inflammatories. And then what we'll do is we'll go through and we'll discuss selected herbs that are commonly used for digestive conditions. And we'll go through that. So we'll talk about the actions associated with it, a little bit of background on those. And then after we finish those guys, then we're going to go move on to the actual cases. Okay. So do you guys have any questions before, because we've got a couple more minutes before we need to stop. Let me go in here. Adam's saying they just pulled Zantac off the market. Yep. Zantac's been pulled. A couple of those anti-inflammatory drugs, those are particularly bad. I think the reason why Zantac was pulled off the market was because it was contaminated with some carcinogen. But they're bad for other reasons. Again, if you took it short term for an ulcer, probably you're not going to get cancer from it even short term. But I've had people coming in who've been on these drugs for 20 years, and I just don't think they're very effective. They're not treating the cause. So that's if someone has chronic heartburn, I can tell you that I have great success treating chronic heartburn. Not to be arrogant, but I do. And medical doctors, they put them on these drugs and they're on them for 2 decades, and there's a whole slew of side effects associated with it. So I don't recommend these. Any other questions? Out of curiosity, with the questions I gave you guys for the final exam and stuff, did you find those to be useful when you're going through, when you're doing the study? Okay. Because the goal is not, and I think, to be honest with you, I think the people that took the time, went through the notes, and were able to answer those questions probably were successful on the exam, I suspect, and that's kind of the goal. My goal is not to make anything difficult. Some people said the exam was very different. Some people say it's helpful. Amanda's got a question. Just to confirm, not all herbs that have a stomachic action are automatically classified as bitters. Yes. So one example is marijuana is a stomachic, but it's not a bitter. And unlike the bitters, the marijuana gives you a dry mouth, while all the other bitters give you act as a silent dog. Okay. So next week we will continue from this slide here, and then we'll get into the herbs. And if you guys have any questions, please post it on the Moodle for me, okay? You guys take care and have a great week. Bye for now.